Today, BCX is hosting a health roundtable at the Les Créatifs restaurant owned by Chef Wandi, and they have just taken us on a journey of palatable meals. The sommelier is absolutely wonderful and he introduced us to great tasting wines, and we hosted an ecosystem made by stakeholders from a variety of health institutions and organizations, and we had really interesting, progressive and futuristic health conversations, and we had brilliant ideas in there ranging from telepathology, teleradiology, mobile health, machine learning and artificial intelligence. There's a level of trust that needs to happen between practitioners and the regulation, between public sector and private sector, and between patients and healthcare service providers.
The fact that we've got the different industries that attended today, we've got people from public sector and private sector, we really benefited from engaging and also from admitting that we need to collaborate.
It's so interesting that most of the time that we will wait for the right legislation that allows us to do certain stuff, only to find that there's actually no legislation that is preventing us to do some stuff. So I think it's more about not just thinking outside the box, but think without the box. And I think the moment we start thinking like that, we'll be surprised the level of capabilities that the technology is providing for us in South Africa.
I think the biggest issue is just the financing of it and making it realistic and getting a clear vision as to where we need to go to. From our space where we are, we desire to work with public, we desire to work with any particular party that is progressive in terms of making sure that at the end of the day healthcare is delivered across the board and consistently and with top quality.
So for me, if we can just get to centralize our database and integrate our systems both for private and for public healthcare, so that we start having one set of data sets and then we start saving costs, that would really help in reducing the inequality gaps.
Training and producing the health practitioner of the future, the one who's adaptable, easy to use technology and also embraces it. The West we don't want is having technology that remains obsolete because the health practitioner prefers a hammer and a tool instead of using what is making life easier.
COVID really, we talk about it being the blessing and curse, and I think the blessing is it's for the first time enabled us to really start thinking about it. Prior to this, we would just think of healthcare as just another thing in the ecosystem, but for the first time we're actually looking at it and we're starting to talk about personalized. What does it mean to me? What does my healthcare mean? And we're really embracing that as a community.